12 things your poop says about your health. Your bowel movements may reveal a surprising amount about what's happening inside your body. From the color and consistency to the smell and frequency, every detail may provide insights into your digestive health and, by extension, your overall well-being. It might seem odd, but consider this. Research has shown that changes in bowel habits are linked to significant health risks, including colorectal cancer, which is the third most common cancer worldwide. Shockingly, early signs of such serious conditions may often be detected through changes in stool, making it a silent yet informative health marker. In today's video, we will talk about 12 distinct poop colors and structures and what those say about your health. But how do you ensure a healthy bowel movement? Watch throughout the video and we will tell you how. Now, without further delay, let's get started. 1. Brown color. The brown color of our poop is a fascinating indicator of a well-functioning digestive system, with bilirubin playing the starring role in this natural process. When red blood cells in our body age and are broken down, bilirubin is produced as a byproduct. The liver then modifies this substance and secretes it as bile after processing it. Bile, a crucial digestive fluid stored in the gallbladder, is released into the intestines to assist in the digestion of fats. As bilirubin moves through the digestive tract, it undergoes further transformation by intestinal bacteria, ultimately resulting in the brown pigment that colors our stool. This journey not only highlights the body's efficient waste management system, but also underscores the importance of maintaining liver and gallbladder health for proper digestion and waste elimination. A diet rich in fiber, such as fruits, vegetables, legumes, and whole grains, helps regulate bowel movements, which is critical for the elimination of bilirubin and other waste products. Recommendations around adequate intakes of dietary fiber differ around the world and by age group, but 25 to 30 grams or more daily is widely recommended for adults. 2. Green poop. Although it is frequently surprising, both dietary choices and the body's digestive system may be to blame for green poop. The journey to a green stool starts with the consumption of foods rich in chlorophyll, such as leafy green vegetables like spinach, kale, and broccoli. When these foods are ingested in large quantities, the chlorophyll may impart a green hue to your stool. Another, less direct pathway involves the speed at which food travels through your digestive tract. If food is moving through your system too quickly, bilirubin, the yellow-green pigment that your liver processes and contributes to the brown color of healthy poop, doesn't have enough time to completely break down. This may result in a greenish stool, a sign that the digestive process is happening more rapidly than usual, possibly due to diarrhea or a malabsorption issue. For those experiencing rapid transit times in their digestive tract, focusing on foods that promote digestive health could be beneficial. Probiotic-rich foods like yogurt, kefir, and fermented vegetables may support gut health. 3. Yellow poop. Yellow poop primarily results from a combination of factors, such as dietary choices, specifically the intake of foods high in fat, and conditions that affect the digestion and absorption of fats. When food travels through the digestive system, bile salts from the liver give it a greenish hue, which enzymes in the intestines then break down. The presence of excessive fat in the stool due to malabsorption issues like celiac disease may prevent this color transition, resulting in a lighter, yellowish appearance. This malabsorption means that fats, instead of being absorbed properly in the small intestine, are excreted with the stool, giving it a yellow hue. Another reason for yellow poop may be a rapid transit time in the gastrointestinal tract. Similar to what causes green stool, where the bile doesn't have enough time to break down completely. Moreover, a diet rich in foods with yellow or orange colorants, such as carrots, sweet potatoes, and yellow artificial coloring, may also contribute to this color change, although this is less concerning from a health perspective. Adults should aim for a dietary fat intake that aligns with healthy dietary guidelines. Typically, about 20% to 35% of total daily calories from fat, with a focus on sources of unsaturated fats like avocados, nuts, and olive oil. 4. Black or tarry stool. Black or tarry stool, medically referred to as melena, signals a specific and often serious condition within the digestive tract. This color change is primarily due to the presence of blood that has been digested as it moves through the gastrointestinal system. When bleeding occurs in the upper GI tract, such as from the stomach or the upper part of the small intestine, the blood is exposed to digestive enzymes and bacteria as it travels through the intestines. This exposure causes the blood to darken to a black color by the time it is excreted, giving the stool a tarry appearance and a distinct foul smell. If more than 100 milliliters of blood are lost from the upper gastrointestinal system, black, tarry stool is observed. Another potential cause of black stools is the ingestion of certain substances, such as iron supplements or medications containing bismuth subsalicylate, which may also darken the stool. 4. Individuals prone to ulcers or gastritis, moderating the intake of irritants like alcohol, caffeine, and spicy foods may reduce the risk of GI bleeding. For those on iron supplements, it's important to follow the prescribed dosage and not exceed it. 5. Red poop. Dietary factors are the most straightforward and harmless causes of red stool. Consuming foods rich in red pigments, such as beets, cranberries, red food coloring, or tomato-based products, may temporarily tint your stool a reddish hue. This color change is typically harmless and resolves once the food has completely passed through your digestive system. However, when the cause of red stool is not dietary, it may indicate the presence of blood in the feces, a condition known as hematochezia. This bleeding is usually from the lower gastrointestinal tract, including the colon, rectum, or anus. Potential causes of this type of bleeding include hemorrhoids, anal fissures, diverticulitis, inflammatory bowel disease, or colorectal cancer. In these cases, the blood has not been digested, unlike with black stools, so it retains its red color. In a study involving 40 children with bacterial diarrhea, blood, mucus, and pus were found in their stools. Limiting the consumption of red pigmented foods may help in distinguishing between diet-induced red stool and potential bleeding. Early diagnosis and treatment of gastrointestinal bleeding may prevent complications and address any underlying health issues. 6. Pale or clay-colored stool. Pale or clay-colored poop is a distinctive sign that often points towards issues with the bile duct system. Bile, a fluid produced by the liver and stored in the gallbladder, plays a crucial role in digesting fats and also imparts the normal brown color to the stool. However, if there are blockages in the bile ducts caused by gallstones, inflammation, or tumors, the color of the stool may change to a lighter shade. Additionally, conditions affecting the liver itself, like hepatitis or cirrhosis, may impair bile production, leading to lighter colored stools. Apart from that, as liver function declines in patients with hepatocellular jaundice, their stool color may shift to clay, reflecting impaired bile excretion. Importantly, if clay-colored stool in a jaundiced patient tests positive for blood, it could signal severe issues, such as cancer of the pancreas or the ampulla of Vata. Foods rich in antioxidants, such as fruits, especially berries, vegetables, and whole grains, may help protect liver cells from damage. Limiting the intake of alcohol and foods high in saturated fats is also crucial to prevent liver disease and gallstones, which may obstruct bile flow. 7. Hard, dry poop. Hard poop is a common issue that many people experience, and it's often a sign of constipation. This condition occurs when stool moves too slowly through the digestive tract, causing it to lose more water than usual. As the large intestine absorbs water from the waste material, the longer the stool remains in the colon, the more water is absorbed, making the stool hard and dry. This process makes bowel movements difficult and may lead to discomfort or pain. Several factors contribute to this slow transit time and hardening of stool, including a diet low in fiber, inadequate hydration, a lack of physical activity, certain medications, and ignoring the urge to have a bowel movement. If you suffer from constipation, you should consume more fiber to add bulk and softness to the stool, making it easier to pass. Hydration is equally important. Drinking enough water keeps the stool soft, and the recommended daily intake is about 4 liters for men and 3 liters for women from all beverages and foods. 8. Loose, watery poop. Loose, watery poop, often referred to as diarrhea, occurs when stool moves through the digestive tract too quickly for the colon to absorb water effectively. The mechanism behind diarrhea involves the secretion of fluid into the intestines or the prevention of fluid from being absorbed, both of which result in a higher liquid content in the stool. In the case of an infection, the body may also try to flush out the offending organisms by speeding up bowel movements, contributing to the loose texture of the stool. Acute diarrhea is when someone experiences a sudden rise in the frequency of their bowel movements, specifically 2 or more loose stools daily, lasting for less than 15 days. A number of things, such as infections from bacteria, viruses, or parasites that irritate the lining of the intestines, may be to blame for this rapid transit. Food intolerances or allergies, such as lactose intolerance or celiac disease, may also lead to diarrhea by triggering an abnormal response in the digestive system. Additionally, certain medications, like antibiotics, may disrupt the natural balance of bacteria in the gut, leading to loose stools. Foods that are easy on the stomach, such as bananas, rice, applesauce, and toast, commonly referred to as the brat diet, may help in managing diarrhea by providing nutrients without overstimulating the digestive tract. 9. Presence of mucus. Mucus in our poop is actually a normal part of the digestive process, albeit in small amounts. The intestines produce mucus to help lubricate the lining of the colon, facilitating the smooth passage of stool. This mucus also plays a crucial role in protecting the intestinal walls from bacteria and other pathogens, supporting the body's immune response within the digestive tract. However, when there's an excessive amount of mucus, it may indicate various conditions affecting the gastrointestinal tract. Several factors, such as inflammatory bowel diseases like Crohn's disease or ulcerative colitis, infections like bacterial infections, or even irritable bowel syndrome, may cause this overproduction. Apart from that, proctitis may also be the reason. It is an inflammation of the lining of the rectum that may be short-term or long-lasting. The most common symptom is having a frequent and urgent need to have a bowel movement. 10. Strong, unpleasant smell. The strong smell associated with our poop is a natural part of the digestive process, primarily resulting from the breakdown of food by the digestive system and the action of bacteria in the gut. When we consume food, it's broken down in the stomach and intestines into its constituent parts. a process that produces gas and compounds as byproducts. These gases, including hydrogen sulfide, methane, and carbon dioxide, are partly responsible for the odor of stool. The presence of bacteria in the large intestine further contributes to this smell through the fermentation process, breaking down undigested food, especially proteins and sulfur-containing foods, which may intensify the odor. Certain foods, such as garlic, onions, broccoli, and cabbage, may lead to a more pungent odor due to the release of sulfur gases during digestion. Consuming large amounts of meat or fatty foods may also contribute to a stronger smell because fats are harder to digest, leading to more fermentation and, consequently, a more noticeable odor. If you moderate the consumption of such foods, this risk will be mitigated. If you notice a persistent change in the smell of your stool overnight with watery stool that is particularly foul and cannot be linked to diet, it may be linked to food poisoning. It's better in that case to consult a healthcare provider. 11. Frequent changes in poop consistency. Irritable bowel syndrome significantly impacts poop consistency due to its effects on the function of the gastrointestinal tract. IBS is characterized by a group of symptoms, including abdominal pain, bloating, and changes in bowel habits without an identifiable organic cause. Normally, the muscles of the intestinal walls contract in a coordinated rhythm to move food through the digestive tract. In irritable bowel syndrome, these contractions may become irregular or exaggerated. When contractions are stronger and last longer than normal, they may lead to diarrhea by pushing food through the intestines too quickly, not allowing enough time for water absorption, resulting in loose or watery stools. Conversely, if the contractions are weak or slow down the transit of food, it may lead to constipation by allowing too much water to be absorbed from the stool, making it hard and difficult to pass. In addition to that, stress and anxiety may also impact gut health and alter stool consistency. The gut is often referred to as the second brain due to its sensitivity to emotional and psychological stresses, which may speed up or slow down digestion, leading to changes in stool consistency. 12. Pencil-thin poop. Pencil-thin poop may be a concerning sign, often indicating a narrowing or obstruction within the colon. The digestive process itself remains largely unchanged in this scenario. It's the physical obstruction or narrowing in the colon that alters the stool's shape. Despite the body's attempt to process and eliminate waste as usual, the presence of a constriction modifies the final appearance of the stool as it exits the body. Several conditions may lead to such a narrowing, including benign polyps or inflammation from conditions like Crohn's disease or ulcerative colitis. These conditions may cause the walls of the colon or rectum to swell, narrow, or develop growths, thereby reducing the diameter of the passageway for stool. Some people may be concerned when they see stringy stool because they've read or been told it's a symptom of colorectal cancer. In a study involving 628 patients over 40 years old with symptoms like anemia, rectal bleeding, or a change in bowel habit lasting more than 4 weeks, it was found that 22% were diagnosed with colorectal cancer. The American Cancer Society, however, asserts that non-cancerous conditions like infections, hemorrhoids, and irritable bowel syndrome may be to blame for stringy stool as well as other colon cancer symptoms. It's clear that our bowel movements hold more significance than we might have initially thought. While understanding these 12 distinct poop colors may empower us to make informed decisions about our health, it's crucial to remember that self-diagnosis has its limits. If you notice persistent or significant changes in your bowel habits, seeking medical consultation is not just advisable, it's imperative. Let's not underestimate the importance of professional advice in deciphering the messages our bodies send us through something as mundane yet insightful as poop. Today, we learned about all the things that our poop has to say about our health. But did you know that there are other useful things in your pantry that may be just as helpful? Want to find out more? Watch 12 powerful health benefits of apple cider vinegar you never knew about. Or watch use baking soda on your body every day for 1 month. See what happens. You may watch either or both of them. Will you be noticing your stool from now on? Let us know in the comments section below.